Because it's uncomfortable?
Yeah,
Is
well,
it too
yeah.
low or too?
I'm okay. I'll get a little bit of pain, so I'm stretching it.
And where are you getting the pain?
Um, just in the, in the
Okay.
back here. It's
Okay.
almost like my body doesn't. I'm not laying totally flat yet, but it's getting there.
Okay.
It's sort of a little twisted up in my neck.
All right.
Like I was gonna say, my body, it's just kicked off to where it just wants to open up and stretch more.
Mm-hmm.
And before, there was like just nothing. So now it's just like I'm stretching a whole lot more, moving a lot more.
Now, oh, there it is.
Yeah,
The
I feel that. It's tight. But yeah, I mean, I totally feel like this is
pinch.
just moving even faster now. You
Okay, this is
the
for the.
train's going quicker. Before they're barely, like you said, the bus is barely rolling. They got it just stalled.
Now this is for the camera, um, or for the audience. I'm gonna send this to everybody who's involved in this, meaning the government, administrators, academics, anybody who wants to understand how this works. But so you've been dealing with this neck problem for how long?
25 years.
Okay, so you got a scar here and you got a scar there. Okay, so that's just to let them know that what you've been going through now. Is it okay if I send this off to everybody?
Sure.
I'm gonna send it to Cruz, Ted Cruz,
Okay.
and I'm gonna try to link it to the White House too.
Okay.
The so let me walk you through the history of this. Is that there's a doctor Syriacs, I forgot his first name. He had set a principle, and the principle was if you have pain, you find the pain. Well, all pain has a source. You find it, apply something that benefits the source, and then the pain goes away. Okay, so within that statement, that means no one should have pain. If all pain has a remedy, okay. Ooh. And then Hippocrates said that healing comes from within. The forces are there. So you have to figure out what's blocking, if there's a deficiency, or there's a need. And both of those are very simple concepts. The the other concept is if you have uh, an appendicitis, you reach in, you touch, remove the appendix, and you'll never have appendicitis again. If you have back pain, you massage it, and the back pain will go away. Massage, stretch, range of motion maneuvers. So if the back pain comes back, you just keep doing it. How many times you have to do it? How many times you need to do it. The appendix, you remove it once and it's gone. Um, but this is the false step. Someone said that you can only treat pain that you see on an x-ray, and you have to treat it in the operating room. And if the patient improves, great. If the patient doesn't improve, you go back in and you repair what you repaired. So the x-ray has to look good. The problem with that is that skeleton doesn't cause pain. Only muscles cause pain. Or everyday aches, pains, and stiffness that you would get in your back or your neck. So by someone saying you have to find it on x-ray, you go right past okay? You go right past the muscles to the bone. That's accepted, that's standard, but that's not true. You cannot fix pain in muscles by fixing the bone. So, but that's very profitable. So what they did was just simply change the rules. They said, well, muscles don't really cause pain. Trigger points don't really cause pain. And all the people who studied how to treat pain out of the muscle were all charlatans. They were edgy. They were kind of quirky. They weren't science-based. It's all anecdotal. Then it was set, beautifully set, to take advantage of everyone. So nobody thinks muscle. Everybody thinks bone. I have patients coming in and say, well, I have C5, C6. Okay. But that's not pain. Those are words. Where's your pain? Well, it's C5, C6. Well, show me where your pain is. And then usually they'll point in their shoulder, their upper arm, or their forearm. I says, but you have pain in the arm. Why did you say it was C6? Because the doctor said it was C6. Wait a minute. You have pain in your arm. Did he ever touch you down here? No, he just said it was C6. Did he ever apply any therapy to your arm? No, he said it was in my C6. You see where I'm going? Mm-hmm. Okay. So you can't see pain. You can only feel it. And you can only touch it, massage it away. So within that idea comes massage. Now, this is the killer part of this is the Renaissance in the 50s and 60s. These doctors actually rediscovered, this is gritty, rediscovered how to, I'm going to put a little, it's going to be a little Kenlog in that. They actually rediscovered acupuncture with a more biological, physiological, anatomical connection. So basically it is truth. So, 1 second. Is that loosening up at all?
Yeah, oh yeah.
Okay.
I've moved it. The paper under my nose is tickling me.
Okay. So Dr. Hackett, Travell, Pybus, Racklin, Gunn, all those folks actually teased out the truth of acupuncture and wrote books about them. Every one of those guys have been marginalized, disrespected, because if you marginalize and disrespect somebody, you say, I don't want to read their book. But I did. And all of the evidence is there. Okay, so the idea is that you have to touch muscles to activate the healing process. If you touch muscles to activate the healing process, they'll heal. How much to apply? Whatever they need. Finger pressure may not be enough. Then you have to benefit it with another tool, and that's a thin needle tool. And if that doesn't benefit it, then you have to use a cutting tip tool, and that's this. And we tried the thin needles on you, and they just didn't do very much. They couldn't activate enough. They couldn't break up enough of the muscle fibers and micro scars. So once we started doing that, we're making progress. Now, how much time and effort will it take? Whatever it takes. Why would I treat you halfway and not completely? That's like you have cancer and I'm going to say, well, I'm only going to treat you halfway. Well, why not? Well, because that's all I'm going to do. Or the insurance companies won't pay for it. Well, why won't they pay for it? Well, because they're trying to save money and they don't understand. Well, can you tell them? No. Yeah, I've tried to tell them, but they have been told not to listen. Pinch. Believe it or not, they've been told not to listen. They've been told to follow the rule book. And the rule book says that what I'm doing right now, and all the variations of it, are banned from use. And if any doctor uses them, they're going to be harassed and bullied. Because now we have these digital footprints, and when we send the bills in, red flags come up. So these investigators come out, and then the bouncers come out, and if they don't work, then they'll send in bounty hunters. And the bounty hunters can basically deny you treatment based on what I write, not on why you're here and what I'm doing, based on what I write. And if I don't write it exactly to fit that auditor's needs, they'll just say no, which is bizarre. Because basically they're practicing medicine remotely. And that's illogical. It is utterly illogical. But it's legal. It's legal for someone it's legal for someone in Florida to look at my records and say that this patient does not deserve treatment. Why? Because the treatment offered has to be closely regulated. Why? Because someone said it has to be closely regulated. Why? Because that's part of the game. The part of the game is to keep you bewildered, in pain, confused. Now, doctors don't understand this. Why? How do I know? Well, it was me. And everybody I talk to about this don't understand it. So they don't understand it. Administrators don't understand it. The government doesn't understand it. The Surgeon General doesn't understand it. NIH doesn't understand it. Or if they do, they're denying it. Why? I don't know. I'm gonna... You okay? So we have a confused system that is turning you guys into ATM machines. Why do I say that? Is that what it seems like? How we doing? Okay, so the assumption is that there's this thing in a muscle called a trigger point. And the trigger point is causing the muscle pain. If a muscle doesn't have a trigger point, it can't cause pain. But they don't realize that sometimes a muscle doesn't present itself as a trigger point. There's like 30 muscles in here. And how am I going to find a trigger point in all the 30 muscles? It's impossible. It's illogical. It's unreasonable. Someone messed it up. So they said that a trigger point is this thing that you can actually find, actually touch, and actually remove. That's not true. The focus of the therapy is in the muscles. You hanging in there? The focus of the therapy is the muscles. And all muscles. If you make the assumption that muscles can cause pain, which is that's a truth, then you have to apply the medicine to the muscles. If you don't apply the medicine to the muscles, that's like treating cancer with penicillin. You can't do it. Now, treating cancer with penicillin in this concept is absolutely legal. And guess what? If you say something, Doc, I'm not better, guess what they'll do? They'll think you're crazy because they have been told that this penicillin is the treatment for cancer. So if you don't get better, they'll say, oh, well, I guess he's one of the losers. You die. They'll say, well, I guess it was inevitable. No, it's not. So another part to this is that another part of the game is, if a patient complains, don't listen. If a patient cries, give them something to suppress their cry. Don't treat their problem. Don't help them. Just give them a pill. Or perpetrate treating them with an idea that's not grounded in reality. It's not. It's impossible to treat pain in muscles by treating the skeleton. Now, serendipitously, they cut through the muscles to get to the skeleton, but that's, how can I say it, stupid. Ignorant. There's this philosopher, humanitarian I've been reading. His name is Jacob Bronowski. He's looked at every tragedy of mankind and came up with a statement. Anytime humans are used as slaves or income sources, it's about arrogance, ignorance, a belief system, dogma, and the ability to muffle people's cries or not even look. Sort of like that, the three monkeys: see no evil, speak no evil, hear no evil. So they don't listen anymore. They just turn you invisible. Some doctors will even think that you're trying to cheat the system and basically, what is it called? Make you an adversary. Oh, this patient's trying to set me up. I better get rid of them. And then they'll write you off. So it's almost like you become a liability. That's because they don't know that they have been tricked. How do I know they've been tricked? Because I was tricked. I was tricked. So now, since the Affordable Care Act, these bounty hunters have gotten very aggressive. They're trying to tell me that what I'm doing doesn't exist and is illegal. They're trying to tell patients who come in with pain that they don't really have pain. They're just coming here for something. I don't know what they're coming for. And they're going to deny elderly patients the opportunity to be free of pain. And they just do it with a flip of a checkbox. No. And it's like, wait a minute. You're practicing medicine remotely, without a license, without even examining the patient. That's totally legal. It's not right, but it's legal. And throughout history, has been a lot of, that's not ethical, that's not moral, that's inhumane, but totally legal. And nobody moves. Okay, I'm going to turn this off now.